Morning guys, so I haven't done a video on anything medical for quite a while. I've been actually prepping for a bodybuilding competition which is next Sunday. So as you can see from my face, it's pretty lean. Just out there at 5 o'clock in the morning doing my cardio. I must admit, living in Whitstable in Kent, it's a nice place to live. I mean, here's the sunrise. Pretty cool this morning. So yeah, I just want to jump on here and talk about MRIs and possibly their pitfalls. So it's a bit windy today, but hopefully you can hear this. I've had 3 patients recently that have all had MRIs and nothing was found, but they still had pain. The first one was a girl. She's had 18 months of shoulder pain. She's been through the mill, through the NHS physio. She's had an MRI, didn't see anything. She saw the consultant. She had 2 steroid injections in the shoulder, which begs me to believe why, if they couldn't find a proper diagnosis. They then put it down to maybe the COVID booster vaccine. Then they talked about thoracic outlet syndrome, which is basically where the nerves in the neck come out to just before they go into the axilla and they split you down the arm. You could be trapped there, but she wasn't really getting pins and needles in her hand, which she normally would do with that, possibly. Basically, when I assessed her, she hadn't got full range of movement in the right shoulder. She was able to lift it, but it was stiff. And when I moved it for her again at end range at the top, it was stiff. On testing power, she had plenty of power, so the rotator cuff was fine. So what I found, I've seen this before, especially rugby players, is the shoulder, like any joint, was stuck. What I mean by stuck was, it just wasn't moving properly in the groove. The shoulder doesn't sit fully into the socket. It's sort of held there by the ligaments of the shoulder and by the rotator cuff. So it can slip, and I'm not talking about subluxation or a dislocation, which will be seen in MRI. I'm talking about a typical, like a joint in your back or neck which is stiff and not moving properly. MRIs won't pick this up. What picks this up is people like me who assess somebody, look at their movement function, compare the other side, something's not right, and then we try and mobilize it to get it moving. Needless to say, I popped the shoulder joint, little pop, and she lifted her arm up, no problem. She started to cry, God love her. So again, that is a situation where the MRI didn't pick up a very simple misalignment movement in her shoulder, and the consultants didn't pick it up, which, to be honest, over the years from work, the consultants don't really look at fine movement. They look at gross movement and how things are operating, and look at MRIs, and that's their job really. They're looking at more severe stuff that needs to be operated on or maybe injected. So that's that one. The second one was a semi-professional football player. He's playing out in Spain. He had lateral knee pain, the outside of the knee. Again, physio, MRI, found nothing. So he came back to the UK, came to see me, and basically I found that his fibula head, which is the small bone on the outside of the leg, was restricted, it wasn't moving properly. Again, MRI won't see this. So we adjusted it, got it moving a bit better, did some rehab, but every time we went back to playing football, it kept hurting again. So obviously this joint's a bit unstable. Every joint has a capsule, which is a small film of tissue that sort of incorporates the joint. So what we've done was we put a little bit of corticosteroid into the joint. It's called the tib-fib joint, tibia-fibula joint, and we'll see how he goes, but I'm pretty confident that will settle that down. The third one was a hip. Again, this lady had a 2-year history of sort of groin pain, hip, sort of around her glutes, tracking down to her knee. MRI showed up nothing really, consultants, nothing. Sacroiliac joint. So the sacroiliac joint is at the side of your lower back. It's, I've had a scale to show you here, but basically it's a common area that gets restricted, can cause groin pain, which people could represent as a hip pain. Some men get testicle pain with it, but the pain can track down to the knee. Again, MRI will not show the restriction on this joint. So there's some food for thought. If like all patients come in, only get an MRI, I'm going, why? Let's assess you first. If you get a good clinician who can actually assess you, they'll get a fair idea of what's going on, and then try have a treatment plan to see if that will work. If it doesn't work, well then we go for scans to see if the diagnosis you made is correct or if there's something different. It's the same situation with disc problems. Somebody goes through the door with a clear presenting disc, i.e. they have pain tracking down the sciatic nerve, pins and needles numbness, they got weak muscle power, you deduct this disc. I say to patients, let's give it 3 or 4 sessions to see if we can improve this. If it's not improving, well then let's send for a scan, because then you need to go for injections. So the moral of the story is, trying to get a scan, yes, they're cheaper nowadays. You can get a scan between 250, 300 quid in London. Around here in Kent, they're about 450, 460. But rather than going for that expense privately, why don't you see somebody first who knows what they're doing? And then maybe you'll save some money that way. Because the alternative is go through the NHS. Well, that you'll wait forever. So, hope this gives you a bit of thought. I hope you can hear through the wind. I've got 1 week to go to this show, so not too many more long hour cardios in the morning, which is great. And I'll see you again soon, guys. Bye.